Osis is different.
Alright, so now we're going to talk about endometritis, which is infection and inflammation of the uterus. It is not the same as endometriosis. So, the most common causative organism for endometritis is actually E. coli, which makes sense because of the proximity of the GI tract and the vaginal tract. But the major risk factors for developing endometritis are people who have prolonged labor, people who have C-sections, and people who have excessive blood loss, either from C-section or vaginal delivery.
So that's why, ladies, always wipe front to back so we don't invite E. coli to the party. Alright, so signs and symptoms of endometritis. Big thing, temperature, 100.4, remember that's on the test. 100.4 on 2 consecutive visits, or whatever you want to call it. Also, anorexia, fatigue, foul smell, which is big, lochia, increased white blood cells, pain. Those are things you want to look for. And for treatment, ampicillin and clindamycin. That's on the test too, so write that down. Also, you want to hydrate, rest, cool compress, sitz bath, and perineal care. So that's pretty much it for endometritis.
Go.
Alright, last video. We're talking about pulmonary embolism. So, the ladies that are at risk for pulmonary embolism are those that have suspected DVT, which is deep vein thrombosis. And that's pretty common. It's the unilateral leg pain. And the calf, you might have calf tenderness, swelling. So, if you have that, you don't want to touch it. You want to call a physician immediately, just to make sure that it doesn't get dislodged. So no moving bed rest. So things you want to do is you want to inspect and auscultate if you suspect someone that has a DVT. And certain signs will include chest pain, cough, dyspnea, tachypnea, crackles, and nervousness. So these are all signs that there is a suspicion of PE.
Alright, and this might be an essay question, so make sure you pay attention, write this stuff down. So our interventions for suspected pulmonary embolism, as Rodney already mentioned, you're going to want to do a full respiratory assessment, pulse ox, lung sounds, vitals, everything if you suspect a pulmonary embolism. First thing you're going to want to do is you're going to want to sit them up so that they can breathe easier, semifowlers. You're going to want to hyperoxygenate them, so give lots of O2. Call the provider because this is an emergency. And also, if they don't already have an IV, you're going to want to get one started because most commonly they're going to get IV heparin as an anticoagulant, okay? So those are the main interventions for pulmonary embolism.